Hey guys, welcome to PTs Snacks podcast. This is Kasey, your host. And if you're tuning in for the very first time, welcome. But what you need to know is that this podcast is for physical therapist students, physical therapist assistants and students, anyone who is in that field, in that realm, who is trying to invest a little bit at a time on making themselves a better clinician or provider. Today, we're going to be talking about dry needling and what we believe is happening to offer pain relief with dry needling. But before we do that, if you've listened to the show at least 3 times and you feel like it's been really helpful for you, if you wouldn't mind leaving a review wherever you listen to podcasts, that would really be helpful. Or if you're on YouTube, hit subscribe, etc. Other than that, let's go right into it. So why are we talking about dry needling? Unless you've been living under a rock, or maybe you're in a place where you don't really offer dry needling, there's a lot of physical therapists who have been using dry needling to help their patients meet their goals, essentially. Now, think about this from a perspective if you're a patient and maybe you've never had it before, you've never been to physical therapy. Imagine them being like, yeah, we could try dry needling for you. And they're like, what is it? First of all, it's called dry needling because it's not a hollow tube. You're not injecting any medicine, hence the term dry. Or how does this differ from acupuncture? There are several differences in how it is administered, etc. But also being able to answer the question of, why are we doing this? Why do you feel like dry needling would be helpful? Or if your patient may have heard of it, they've seen it done before, they want to know, what is it actually doing? We don't want to just be like, it helps increase blood flow. It is helpful to be able to at least see what the current research is saying so that we can give our professional opinion, but also professionally understand when it may be beneficial for our patients or not. So we're going to talk briefly in this episode, like I did on the benefits of exercise with pain relief on dry needling. So essentially, we're going to cover 4 main avenues in which we believe that is having an impact on the patient's system and what that entails. Remember, this is a pretty brief episode, but I more so want this to be a launching pad of, oh, I never thought of that before. Let me do a deeper dive on my own. So, sound good? Okay, so essentially on a broad spectrum, dry needling likely works at both a local level and a systemic level. Local meaning wherever you administered the dry needles, and systemic meaning body-wide. With regard to a pain modulating aspect, we're not just like releasing knots here per se. There are 4 main key mechanisms that we're talking about. Local muscle and tissue effects is number 1. Biomechanical and inflammatory changes is number 2. 3 is peripheral and spinal pain modulation. And then number 4 is supraspinal and autonomic mechanisms. Those are the aspects that we're going to talk about. So let's dive into number 1. In terms of local muscle and tissue effects, we found that when we dry needle a quote-unquote trigger point, it actually can help to reduce abnormal electrical activity at the motor end plate and may disrupt a top band characteristic of myofascial trigger points, which is what we're defining here as a trigger point. It can change the local blood flow, hypoxia, and inflammation around the trigger point, potentially normalizing previous ischemic irritated area. So that's why a lot of people say, oh, it increases blood flow to that area. And there has been some animal work that has been done to show improved muscle strength and function and increased antioxidant activity after dry needling a specific area. So we know that there are local muscle and tissue effects with dry needling. Now, when we're talking about number 2, which is biomechanical inflammatory changes, there was a 2025 systematic review that found that dry needling actually altered multiple pain-related biomarkers, including increasing beta endorphin, IL-2, IL-6, TNF-alpha, nitric oxide synthase, and decreasing substance P, CGRP, and acetylcholine in its receptors in a muscle. So when we're hearing these shifts, essentially what it's talking about is these suggest both a pro-inflammatory micro response that we need for tissue repair. That's a normal part of tissue healing is that inflammatory response, but also a anti-nociceptive effect that reduces pain signaling. So we're getting healing with a mixture of pain relief. Sounds like a good combination, right? Now, number 3, we're talking about peripheral and spinal pain modulation. So needling can actually reduce peripheral nociception from trigger points, and it can dampen dorsal horn neuron activity, which decreases peripheral and central sensitization. So essentially, it helps to activate inhibitory spinal mechanisms, or our gate control theory, and opioidergic, say that 5 times fast, serotonergic and noradrenergic pathways. I had to read that off of my notes. Sorry. Now, it can also inhibit spinal mechanisms like in our gate control theory. So I'm going to read these off because I always mispronounce these for whatever reason. But it's specifically in our pathways, our opioidergic pathways, serotonergic pathways, and noradrenergic pathways, which helps to reduce pain transmission. So essentially, the signals that are being sent to our body say, hey, we're having pain, we're getting less of those signals. So it can help someone, imagine, if they're getting less of this, either be able to tolerate more exercise, things that help with long-term effects, or even just get through their day a little bit better. And then lastly, we have supraspinal and autonomic mechanisms that can help with pain relief pathways. So dry needling can actually activate the sympathetic nervous system acutely, which we can see through an increased heart rate, and raise pain pressure thresholds both locally and at distant sites, showing central pain modulating effect. There have been several reviews that describe descending pain inhibition from brainstem structures and engagement of the hypothalamic pituitary adrenal axis and endogenous opioids and endocannabinoids. We have multiple avenues and ways that dry needling can help with pain modulation. Now, let's also flip this over because I like to play devil's advocate too. With these sorts of things, remember that dry needling is a modality and it can be helpful in especially the right circumstances. So for instance, if your patient has a metal allergy, or maybe they're terrified of needles in general, that person may not be a good candidate for dry needling. We need to make sure that we are also using our clinical brains and not just putting on blinders of, I know this is good. This research should be combined with the person in front of you and also what you're comfortable with. So with that aspect, remember, we need to educate our patients on all what this entails, educate them on the risks of this too, especially if you're in an area that you're dry needling that is close, let's say, for instance, to the lung field. But also explaining, depending on what they are coming to see you for, how this can be used in conjunction for, let's say they're trying to help prepare their body to have less pain for a marathon. We also still have to include components that help their body to train for that event, not just the pain relief, feel-good stuff, but also the things that create long-term tissue adaptation. So it is important to work on both. You just might need to meet your patient where they're at in terms of what they can tolerate, what their pain level is, and what they're willing to do. So that being said, use your brain. If you have any questions, feel free to reach out at ptsnackspodcast@gmail.com. I hope that this episode was helpful for you. I know it's a short one, but take deep dives. If you are not on the newsletter, be sure and check that out because I also do include short summaries and tips in there in case you're not able to listen in for the podcast. But other than that, if you guys need anything, please let me know. If there are study guides that you would like or topics in the future for future episodes, I really do listen to that and take it into account. But other than that, I hope you have a great rest of your day.